past several months, you may have seen some troubling headlines pointing to a rise in cancer among younger people. One recent study suggests by 2030, early onset cancer diagnoses could increase by 30% worldwide.
So the question is this something we should be worried about? Dr. Natalie Gentile, the founder of Direct Care Physicians of Pittsburgh, joins us to discuss the increase in cases. This is so timely. I know so many women who are my age who have been recently diagnosed with breast cancer. Oh. And it's so alarming to me that I went to ask my own doctor, like, what is happening?
Yeah.
Why is this so prevalent in our area?
It's so scary. I'm seeing it as a physician in my own patient population, and we're all in the same age group, and
yes,
we all have these same stories. So it's definitely something that's causing a lot of fear.
Yeah, but with fear can come knowledge. Do you feel like people are talking to you more about this younger than ever, being that like Mikey's going and obviously not the typical age for a cancer patient?
Yeah, so we're having these conversations earlier on and talking about preventative measures. Also, a really important conversation to have is what are the screening options that are out there?
Right.
Because you have to think when we've got earlier detection, we will likely have more diagnoses at younger ages. So it's not necessarily that deaths from cancer are going up, right? Just more detection of it and diagnosis. So there's that flip side to a very scary thing that at least we've got tools for detection and ways that we can increase our chances of survival and decrease our chances of getting cancer in the first place by prevention.
Absolutely.
And what are some of those ways that you can decrease your risk?
So much of what I do in my work is talking about lifestyle. So, diet is front and center when we're talking about cancer risk. So we know that diets that are higher in fiber, higher in different phytonutrients or plant nutrients, fruits, vegetables, legumes, nuts and seeds, beans, these types of foods can be very beneficial for our gut microbiome. And our gut microbiome and gut health is very much tied to our immune system and inflammation.
I feel like now more so than ever, gut health is having a moment. And I'm so glad to hear about it because I never have before, but also why haven't we? Is it now because you're realizing that connection?
Yeah, it's still in its preliminary space, right? Like we still have upcoming research about gut health. And there's, of course, that whole wellness culture that's taking it and trying to give you supplements for it. But when we go back to kind of evidence-based basics around gut health, we know if we can improve our gut health through, for example, plant diversity, so different types of plant intake, proper exercise, stress reduction, hydration, minimizing alcohol intake. Like we're talking basics here.
Yeah.
We can improve gut health, which then with its connection to our immune system and inflammatory response can decrease that cancer development, right? Because it all comes back to our immune system and inflammatory response.
Yeah, and when I asked my doctor that question, he alluded to the environment. And air pollution, are you seeing that be maybe potentially one of the causes?
Oh, certainly. So if we look at environmental exposures, whether it's, radiation around us, air quality in Pittsburgh, big topic, big problem.
As it should be.
Right?
Bad,
yes. Smoking. Okay, smoking yourself or exposure to smoking. Some of these things are environmental, right, and very much play a role in cancer risk.
Absolutely. Now, if someone's watching right now and thinking, oh, well, I can't change the environment, I hate legumes, I just can't do this, what would you say? Because I know that you are a very realistic doctor. You know that huge changes can't happen overnight. Right. What are some changes, very small, easy things that we can do to kind of prevent this?
Yeah, so I talk to my patients about really taking a 30,000-foot view of their life. Is stress really a major thing for you? Find the major thing. Man, I just never move. I never exercise. I hate vegetables. Like, find something that seems to be of those lifestyle factors I reviewed. One of them really seems like something that's tangible to you and realistic to affect change. And go from there. Making an incremental change in one of those buckets can make a big change long term. But it has to be, again, realistic. And I think also most people to make change need to have some type of impetus or engagement in it.
Yes.
For example, I have a family history of cancer, right? Like something like that really makes them start thinking about it. So what is your why? Because when you can identify the why, you're more likely to make those changes that are sustainable.
Yeah,
absolutely.
And for those people who are battling cancer right now or know someone who is, I mean, with the technology that we have today, it's not a death sentence. So what do you feel as though a good mindset would be to have for somebody who is dealing with this?
Yeah, so a support system is number one. So that's what I'm seeing really helpful in my patients that are currently dealing with cancer. So having a positive support system, knowing that you need to advocate for yourself oftentimes in different spaces. So if you can't do it, having somebody with you who can.
Okay.
And then arming yourself with all of your treatment options and having honest conversations to weigh the pros and cons of those treatment options. But a lot of the things that we talked about for prevention also go into treatment. So the exercise, the mindfulness, stress reduction, sleep, all of that has to be in order as well, so that you can take care of yourself even when you're getting, external treatment as well.
Oh my gosh,
All
this
good
is
information.
fantastic. It is.
Yeah.
It is, and easy steps that we can take.
All right, thank you, Natalie.
Thanks, Nat.
If you're interested in learning more about Direct Care Physicians of Pittsburgh, we will have more information on our website, kdka.com/talkpittsburgh.